It is a shame and disgrace, how the Jamaican government has been responding to this catastrophe. Shame and disgrace.
So we have to take these things seriously. Go find a doctor quickly.
A shame and disgrace.
The word from the Ministry of Health this morning is that, listen, we are likely and are seeing a surge in the number of cases, infectious diseases, as a result of the waterlogged areas we have.
A shame and disgrace.
Last Friday, they issued what they call an urgent alert about infections. And people, if you are experiencing fever, headache, muscle pain, red eyes, abdominal pain, and diarrhea, go find a doctor quickly.
A shame and disgrace.
So we have to take these things seriously.
Falmouth Hospital, the Accident and Emergency Department is down, but they are receiving patients. So a field hospital has been erected. At Cornwall Regional Hospital, bed capacity has been severely affected. It means that persons that are coming to the Accident and Emergency Department are going to face a crowded emergency department. Very challenging situation that is there. Noel Holmes Hospital has also been severely affected, but they have the benefit also of a foreign team as well as the local team that are there, and a field hospital is to be set up there so that they will be able to receive patients, and they do continue their services on a daily basis.
That's Dr. Bisesa McKenzie, the Chief Medical Officer. Yes, she says at Savannah Lamar Hospital, the Accident and Emergency Department is overcrowded, but patient care continues. But certainly that is restricted because of the numbers there. The health minister at that media briefing yesterday also urged Jamaicans to take it seriously, noting that leptospirosis is preventable, it's treatable, and survivable when detected early.
Wearing protective gear during cleanup, avoiding floodwater, securing food and water supplies, keeping the environment clean, and controlling rodents are among the most effective steps that we need to take. I've been out there and I've seen where avoiding stagnant water, muddy water is unavoidable in some instances. It's not really a practical request in some cases.
A shame and disgrace.
The next best thing, therefore, is to wear protective clothing for those Jamaicans who are supporting their family members in these communities. Normally they take food items. I think while food is important, very, very important, maybe we can pivot a bit towards now supporting protective clothing for those who have to now are trying to pick up the pieces.
Protective clothing, such as what? Water boots, yeah, overalls, yeah, and frankly, preventable behavior, stay out of the water. Although based on what is happening on the ground, that is almost impossible because there's so much water on the ground.
It is a shame and disgrace. It is a shame and disgrace. It is a shame and disgrace.
So my viewers and subscribers, I'm going to ask you to type one thing for me now, please. Type in the comments, say shame and disgrace, Christopher Tufton and Andrew Holness. Type it for me there. Shame and disgrace, Christopher Tufton and Andrew Holness. It is a goddamn shame how them treat the people in Jamaica. My viewers and subscribers, you hear Christopher Tufton wicked. Leptospirosis is on the loose, all kind of disease, and it is a government must do it, Christopher Tufton said the people who are sorry for them family and carry things come, give them must start bring protective gears. Why I've never said that the government of Jamaica led by Andrew Holness, where I get all the donation, they must take out the money and buy it and bring to the people. Why I've never said the Ministry of Health led by him, worthless, costless Christopher Tufton must take out the money and lead the charge and give the people the protective gear. Notice him never even say what kind of protective gear a mouthpiece add to us, say if a water boot or overall. I am telling you that these people are incompetent. They don't love the Jamaican people, and I believe them want this a thing have to get worse. Wicked and evil. But anyway, my video subscribers, I want you to listen to 119 as 119 I rub them out. Leptospirosis is on the rise and the government seem like they no business at all. They want everybody catch all kind of something Jamaica. They don't care for the people. I want to know if you like and share the video. Like and share the video and listen to Mr. 119 as him rub out the government, and then we get back to the health report. Listen to 119.
It is a shame and disgrace how the Jamaican government has been responding to this catastrophe. Shame and disgrace. You should have shame on yourself. You leave it to private citizens, corporate donors, donor agencies from Jamaica and abroad. What you say? Are them for do it? And our government for do it. And this meeting with Ramesh was nothing but a public relations gimmick. Prime Minister, now is not the time for PR. We don't need no PR. Because I don't know where you set up the cameras. Set up Ramesh, sit down in a chair, record everything, edit it, and put it out. Where that for? We don't need that.
My video subscribers, I say like and share up the video. And if you agree with Mr. 119, type in the comments, say yes, me agree with him, yes, me agree with him, yes, me agree with him. The government is wicked. They have left everything up to the people. Christopher Tufton say, are you were sorry for your family them, and you must buy the protective gears. What about the government? What about the donations? My video subscribers, we have to share this video, and make the world hear. We have to bring down the government because they're wicked. We have to bring down excitement. Make people see how wicked and uncaring and cruel the government be. We spoke about it on the other night, that this was a PR stunt with Ramesh. Imagine Ramesh and everybody else help, and the Prime Minister find time for meet with Ramesh, turn on camera, edit video, and post the video. Why never find time for come help the people and give them some food? Jamaica, the Prime Minister are wicked. Make we go back to the clip. Make we go right back to the leptospirosis and everything where broke out. Leptospirosis, tetanus. Jamaica, didn't the government know this was going to happen? The moment the government of Jamaica said the water sit, we've been hearing from the meteorologist that the water go sit over the land for 3 or 4 days. Right away, them should have in them planning face a rotted cup. If water go sit on the land, that mean X and Y. Make us start put everything in place. As a hurricane run, cut down, we just swoop in as the road clear and start get rid of the mosquito and get rid of everything. I'm telling you, the government is reactive. They're not proactive. They're not prepared for nothing. They only get up and react after, and people's life is in jeopardy. People's lives are at risk, and everybody know that the government is an abject failure. They're wicked, they're evil, they're cruel. Jamaica, listen what the chief medical officer have said. Listen exactly what the chief medical officer have said about this.
Yes, according to Dr. Carr, they're also monitoring for the emergence of other waterborne and vector-borne diseases.
Dengue cases, so far, the cases are within low activity level, even though we are in dengue season. But this may change over the coming weeks. It's a bit too early to see an increase in dengue cases based on what would have happened post-Melissa. Tetanus surveillance, there are increased reports of injuries, particularly nail stick injuries, and delays in seeking care prevents the vaccination of tetanus. We've had 2 suspected cases of adult tetanus post-Hurricane Melissa, one in Westmoreland and one in St. Elizabeth.
So we have to take these things seriously. That's the national epidemiologist, Dr. Karen Webster Carr. And the chief medical officer of the country, Dr. Jacqueline Bisesa McKenzie, also addressed that media briefing yesterday. And she spoke to the hospitals in Western Jamaica that have largely been impacted, their services restricted by Melissa.
Falmouth Hospital, the Accident and Emergency Department is down, but they are receiving patients. So a field hospital has been erected. At Cornwall Regional Hospital, bed capacity has been severely affected. It means that persons that are coming to the Accident and Emergency Department are going to face a crowded emergency department. Very challenging situation that is there. Noel Holmes Hospital has also been severely affected, but they have the benefit also of a foreign team as well as the local team that are there, and a field hospital is to be set up there so that they will be able to receive patients, and they do continue their services on a daily basis.
That's Dr. Bisesa McKenzie, the Chief Medical Officer. Yes, she says at Savannah Lamar Hospital, the Accident and Emergency Department is overcrowded, but patient care continues. But certainly that is restricted because of the numbers there. She says a field hospital is being established to ease the pressure at SAV. At Black River, most regular services are still down, but the Accident and Emergency Department is operational, and there's also a field hospital at Black River that has been activated to receive patients as well. She's urging you, the members of the public, not to delay seeking medical attention if needed, despite the challenges.
And the primary healthcare team, along with local and overseas support, have been able to get back up 60 to 70% of these facilities to normal services, meaning that if any day that you would normally have clinic, you can still go to that facility to see the doctor or to access your immunization or your antenatal care. So we're asking you to try to keep your appointments.
That's the Chief Medical Officer of Health, Dr. Jacqueline Bisesa McKenzie.
So you hear that, my viewers and subscribers? How much hospital burdened? The hospital were already burdened, under-resourced, understaffed, under-equipped, under every single thing. And now this hurricane and the damage that it caused to the structures, and now to have it burdened with all these patients coming there. Boy, may I tell them, my viewers and subscribers, I think we need a change of government right now. We need a change of government, change of leadership. We need change of everything, because Andrew have a runway. Him and Christopher Tufton have a runway. The only way Jamaica go prosper unless Andrew and Christopher Tufton runway. Well, type your thoughts in the comments and share the video with everybody. Share the video by your WhatsApp, your TikTok, your Facebook. Share it with everybody and keep this conversation going and turn on some pressure for them. And if you haven't subscribed to the channel, subscribe to Jamaica Hot Topic. I'm going to leave you with Mr. 119 again. Big up.
Shame and disgrace. You should have shame on yourself. You leave it to private citizens, corporate donors, donor agencies from Jamaica and abroad. What you say? Are them for do it? And our government for do it. And this meeting with Ramesh was nothing but a public relations gimmick. Prime Minister, now is not the time for PR. We don't need no PR. Because we don't know where you set up the cameras. Set up Ramesh, sit down in a chair, record everything, edit it, and put it out. Where that for? We don't need that. It is a shame and disgrace.